Hello to all the students. As the exam day is approaching nearer and nearer, a lot of thoughts come in our mind and a lot of anxiety is there. But if you believe in yourself, you are unstoppable. So, to help you in your revision process, we will be doing a rapid revision of the images in anatomy, and we will be quickly doing it in within 15 to 20 minutes. In the images, whatever images we are covering are all important images, and in that too we will be discussing those important landmarks or those important structures which are very important, and you should be knowing that. So while you are attending this video, ensure that you know all those points and all those landmarks which we will be discussing during this video. So let us quickly start over here. First of all, as you can see that this is the image of the bone scapula, and the points which we have marked over here is, most important point is this coracoid process. This is a coracoid process, and this another process which is present over here is acromion process. Very important. And towards the inferior side over here, this is the inferior angle of scapula. Now another bone which is very important is humerus, and you should be able to identify surgical neck, spiral groove which is located at the shaft, and the medial epicondyle. So you can very well say that these are the landmarks which are present at this location: surgical neck, this is the spiral groove, and this is the medial epicondyle over here. Then apart from this, when we see towards the upper end, this is the greater tubercle, right? This is the greater tubercle of the humerus. We have a lesser tubercle also, which we have not labeled over here, and in between that you have this, what is this? Intertubercular sulcus, or it is also known as bicipital groove. So this is a vertical groove which is present between the two tubercles. Coming to this radius and ulna, you can very easily identify that this is the radius bone and this is the ulna bone. In the radius, you have a very important landmark, a prominence over here, which is termed as radial tuberosity. And when you see the ulna over here, in the ulna, what do you see? This projection which is towards the upper end of the ulna is known as olecranon process. The radial tuberosity gives attachment to biceps, and the olecranon process gives attachment to the triceps. Now a very important X-ray over here. This is the X-ray of the shoulder joint, in which you will be seeing clavicle, parts of the scapula, and the parts of the humerus also. So when you see over here, you can very well identify that this bone which is present over here, this is the clavicle. Then apart from this, the process which you can see over here is which process? Yes, this process is coracoid process. This process is the coracoid process. The other process which you see at this location, this one is acromion process. Then as you go towards the humerus, let us see the humerus over here. This portion is the head of the humerus. As you come lower down over here, this portion is the surgical neck of the humerus, and towards this side we say this is the shaft of the humerus. So these are the very basic landmarks which should never go wrong. So please ensure that you know all these landmarks over here. Now this deformity, which deformity is this? This is the policeman tip deformity, also known as waiter's tip deformity or porter's tip deformity, seen in Erb's palsy. And another very important deformity over here is this one, which is winging of scapula, and you very well know that this is due to the injury of long thoracic nerve and leading to the paralysis of serratus anterior muscle. Coming to this next image over here, if you see this next image, this is the pectoral region, and very important muscle over here, this big muscle which you can see over here, this is the pectoralis major. And when you remove this major muscle, a small muscle which you see in the pectoral region, this muscle is pectoralis minor muscle. Two muscles which are very important over here in the pectoral region. One more muscle over here in this region is this serratus anterior. And if you see in this image, the serratus anterior, we have shown this is the anterior view. This is how it is seen. And in the lateral view, you can completely visualize the serratus anterior muscle. Any of the images can be given to you, the anterior view or the lateral view. Now coming over here, what is this? Yes, this is the image of the back area, the various muscles of the back region. A big muscle towards the upper side is trapezius, and a big muscle towards the lower side, this is the latissimus dorsi. Then as you remove the trapezius, you can see other smaller muscles over here which have been shown in 3 different colors. The green colored muscle, this one is levator scapulae. The black colored muscle is, yes, rhomboidus minor. The blue colored muscle is rhomboidus major. These are the muscles towards the back. Another muscles towards this region which is very important is around the scapula. Supraspinatus, infraspinatus, teres minor, teres major. And we very well know when we see this, the muscle which is present over here above the spine of scapula, right? This is the spine of scapula. Above the spine of scapula, you have supraspinatus. Below the spine of scapula, you are having which muscle? Yes, you are having this infraspinatus muscle. Then between the scapula, you can see that this is the scapula over here, this is the humerus over here. Between that region, we say we are having 2 teres muscle. What? Teres minor and major. The black muscle is teres minor and the green colored muscle is teres major. So these 4 muscle identification is very, very important for you. Coming to the next image, this is the image for the muscles in the anterior compartment of the forearm, in which this image is more important. And when we talk about the muscles, they take common origin from medial epicondyle of the humerus. First muscle, a short muscle, this is pronator teres. Then after that, 2 muscles are going till the carpal bone. The one which is present on the lateral side, this is flexor carpi radialis. The other which is present on the medial side is flexor carpi ulnaris. In between the two, you are having a muscle which is going towards the palm area, and now this muscle is palmaris longus. So these 4 muscles are very important, and when you come to the wrist level, the muscles at the wrist level from lateral to the medial side is flexor carpi radialis, palmaris longus, flexor carpi ulnaris. Now just deep to this muscles, we are having another muscle which is flexor digitorum superficialis, and you will observe that its tendons are going to the digits. When you remove all these muscles, the next image comes this. Okay, this is a deeper image, a muscle which are in the deeper aspect in the anterior compartment only. Now over here, let us first of all zoom the image, and when we see this image over here, this muscle, its tendon is going to the thumb, and because it is going to the thumb, we say this muscle is flexor pollicis longus, right? This is flexor pollicis longus. The other muscle over here is, let us zoom it again, this muscle is going to the rest of the fingers over here, and this is a deeper muscle, so we say flexor digitorum profundus. This muscle is flexor digitorum profundus. Now coming over here, this is the muscle of the hand which is very, very important, the lumbrical muscles over here. And when you talk about the lumbrical muscles, it is very important, the numbering. The numbering is always starting from the thumb side, that is the lateral side, 1, 2, 3 and 4. So very important muscle, lumbrical muscles. Then further as we come over here, this is a very, very important image which is the anatomical snub box. This colored area over here is anatomical snub box, this depression. Then we have shown 2 boundaries, medial and the lateral. The blue colored is the medial boundary formed by extensor pollicis longus, and the black colored is the lateral boundary which is formed by extensor pollicis brevis and abductor pollicis longus. Now this is the image which is showing the deformities in the median nerve injury. The first one over here is this ape thumb deformity. Then the second one is benediction deformity. And this third is the pointing index. These are the 3 deformities which are associated with median nerve injury. And when you see this deformity, what comes in your mind? Yes, this is the partial claw hand. Okay, this is a partial claw hand which is in the ulnar nerve injury. In the partial claw hand, there is clawing of medial 2 fingers. Then coming to this image, you can very well see over here, this is the wrist drop which is in the radial nerve injury. And the radial nerve injury is also seen in these 2 type of palsies. This is the crutch palsy, and this another image which you can see over here. This is showing the Saturday night palsy. Okay, Saturday night palsy. So these two are associated with the radial nerve compression. Coming to this image, if you see what test is this? Yes, this is the Fallon test, and the Fallon test is seen in which syndrome? It is seen in the carpal tunnel syndrome. What happens in the carpal tunnel syndrome? Yeah, median nerve compression. Now this is a very, very important image. This is an image showing axillary artery with its branches, and when you see this image, let us zoom it. Now first branch which is shown over here, this one, this is superior thoracic artery. This branch which you see over here, this is running parallel to the pectoralis minor muscle, and this branch is lateral thoracic artery. This branch which you see is running parallel to lateral thoracic artery is subscapular artery. These are the three most important branches to identify over here. Then apart from this, how will you identify the rest of the branches? Now the second part is giving two branches. So we have already identified lateral thoracic, which is this one, right? So the other branch is thoracoacromial artery. The third part over here is giving this subscapular artery, and the rest of the two branches are going on the lateral side. This one is anterior circumflex humeral, and the other one on this side is the posterior circumflex humeral artery. So these are the branches of axillary artery, very important to identify. Now the dermatomes. Now when you talk about the dermatomes, you can very well see that this is the dermatome of upper limb, and for the upper limb we basically say that you will find the dermatomes from C5 to T1 over here. And how you learn over here? You learn like this: C5 to T1, this is the distribution. So C5, C6, C7, sorry, C5, C6, C6 is going till the thumb, C7 is middle three fingers, C8 little finger, so going on the inner side, and T1 and T2 is going towards the axilla. So the distribution is like this, outer to inner side. Okay, so therefore the thumb is having the dermatome C6. Another dermatome which is very important over here, as you can see we have highlighted over here, this is the dermatome of umbilicus, and this is T10. This is the T10. Now coming to the dermatomes of lower limb, in this you can see on the anterior side the dermatomes are different, and on the posterior side the dermatomes are different. When you see anterior side, it is having lumbar dermatomes, posterior side is having sacral dermatomes. The lumbar dermatomes going one by one, it is going down L1, L2, L3. And now what is important for us over here? L3 at the level of knee, and at the level of leg, L4 is towards the medial side, L5 is towards the lateral side. And when you go towards the foot, on the lateral aspect, S1 has started. So these are towards the anterior aspect, and when you see towards the posterior aspect, towards the heel area, S1 is there. Then posterior aspect of the leg and posterior aspect of thigh, you have S2, which is this is the S2 region. And when you talk about the S3 region, S3, S4, S5, that is towards the gluteal region. So these are the dermatomes for the lower limb. Now when you see this image, what is this? This is a transverse section at the level of, you can say, trachea and the esophagus. And when you see this transverse section, this is the anterior side, because the trachea is on the anterior side, esophagus on the posterior side. When you see the trachea section, it typically appears like D type of section, okay, D section, in which on the anterior side you have hyaline cartilage. So let us see over here. This is the hyaline cartilage over here, which is on the anterior side, the C-shaped cartilage, and on the posterior aspect, the muscle which is filling it. This muscle which is filling this gap over here, this muscle is trachealis muscle. Behind it, the oval shaped section which is present over here, this is the section of the esophagus. So this is the section of the trachea, this is a section of esophagus. In the trachea, anteriorly hyaline cartilage, and posteriorly filled by a muscle which is trachealis muscle. Coming to this image, this is a transverse section of the thorax, and when you see the transverse section, this is the anterior side, this is the posterior side. How do you decide? Because you see this is a smaller section of the sternum, and over here this is the section of the vertebra. Okay, you can see this is a section of the vertebra. Now just in front of the vertebra, you have a round section, and that is a section of descending aorta. So if you see, this is the vertebra just in front of it, this is descending aorta. As you go more in front of it, this section is of the esophagus. And now what is the structure in front of this esophagus? This whole area is heart. So this whole area which is present over here, this whole structure which is present over here, this is the heart. So this is a transverse section at the level of the thorax. This landmark you very well know. In the lateral view of the skull, this landmark over here, this is the Tyrion. Okay, Tyrion. Then coming to this image of the mandible over here, in this one foramen is very, very important, which you can see over here. It is marked over here on the inner aspect of mandible, and this foramen is mandibular foramen, giving passage to inferior alveolar nerve and vessels. Now coming to this image over here, what is this image? Yes, this is the X-ray of the lateral view of the skull, the lateral view of the neck area, which is showing all the cervical vertebra. Now important for you is to identify the vertebrae over here. So when you see this image, you can very well see this is the base of skull. Okay, the blue colored line I've shown is the base of skull. After that, whatever spinous process you see is the cervical vertebra. So this is the first spinous process which you can see. This is C1, and now you start counting C2, C3, C4, C5, C6, and now this one is the C7, which is the longest spinous process. So you should be able to identify the cervical vertebra in this X-ray. Now coming to this next image over here, yes, you can see very well that what is this image? This is the branching of the external carotid artery. And in this, a very important part is that in the neck area, you should be able to identify the common carotid artery, which is towards the lower side. Then at this level, it divides into external and internal. So when you see over here, this is the external carotid. Okay, this is the external carotid, and this small artery which is cut over here, which is shown is internal carotid. So this one is internal carotid artery. Same has been shown over here. Then apart from this, what you see is that we have also marked one main artery which is running obliquely in the face, and that is the facial artery. These are the three very main arteries over here. Apart from this, if you see any branch going to the neck, any branch going towards the neck, towards the thyroid gland, this is the superior thyroid artery. Any branch going towards the oral cavity, we say that is the lingual artery. Towards the posterior side, artery going behind the ear is posterior auricular artery. Artery towards the occipital region is occipital artery. And when you talk about the terminal branches of external carotid, so for that, the artery which goes horizontally forwards, over here is maxillary artery, and the one which goes in the temporal region is superficial temporal artery. These are the other branches over here. Now coming to this image, this is the sagittal section of head and neck, and all these are the important landmarks which you should be knowing. Coming to this image, first of all, in the tongue, this muscle which you see is the genioglossus, right? This is the genioglossus, and the other landmarks over here, this projection which you see, this is the epiglottis. Hard palate, just posterior to the hard palate over here, this projection going is the soft palate. Then towards the upper side, you can see this is the sphenoid air sinus, and in the body of sphenoid, just above this sphenoid sinus, there is a U-shaped depression. There is a U-shaped depression over here, and this is given the term as sella turcica. Okay, this is given the term as sella turcica. So these important landmarks are there in the sagittal section of head and neck. Now, this is a very, very important image. What is this? This is again the sagittal section, but this is now of brain, and either given as this radiological image or given as a gross section, you should be able to identify all these important structures. In this, the C-shaped structure which you see over here, is the corpus callosum. Then apart from this, we say just below the C-shaped structure, there is a component which is given the term as fornix. This is the fornix over here. and just below the fornix, the area which is present over here, this is the area for the thalamus. Then as you go further below over here, you can see the whole brainstem, the three parts of the brainstem: midbrain, pons, medulla, right? So the pons is this expanded portion, above it midbrain, below it medulla. Behind this is the structure which is cerebellum. So this structure over here is cerebellum, and between the cerebellum and the pons over here, this is the pons and this is the cerebellum. Between it you have a triangular area which is known as fourth ventricle. Okay, this triangular area is the fourth ventricle. So a very, very important section. Another important section of the brain, you know, is this transverse section, in which you should be able to identify these nucleus. When you see on the medial side, you are having this caudate nucleus, which is slightly on the anterior side, and a big oval nucleus, which is the thalamus. So caudate and thalamus. And as you go on the lateral aspect, what you see on the lateral aspect, a triangular nucleus over here, which is lentiform nucleus. So these three nucleus are very important to identify. And when you're going from the outer side, when you're approaching the image from the outer side, whatever triangular nucleus you see is the lentiform. The big oval nucleus on the inner aspect is thalamus, and just near to it is the caudate nucleus. Then coming to this image, we know that this is the image for blood supply of the brain. And in this image, this artery is basilar artery. This artery is vertebral artery. Okay, the two vertebral arteries, they combine to form the basilar. And then this is the location of circle of Willis. So we have this orientation of the image over here. And the most important landmarks which you should be able to identify is pica and anterior spinal artery. Pica is posterior inferior cerebellar artery, and both of them are the branches of vertebral. So I will just zoom it over here. Both of them are the branches of vertebral. The branch which is going towards the inner side, right, this one, this is anterior spinal artery. This is the anterior spinal artery, and the branch which is towards the lateral side. So this branch which is coming towards the lateral side. So this branch is pica, or we say posterior inferior cerebellar artery. So these two arteries are very, very important for this image. Yes. Now coming to this portion over here, this is the bony pelvis, you very well know, and the joint which we have marked over here, this is the pubic symphysis. The hip bones, they unite at this point. And when you see the same image in the X-ray over here, so again you can identify that this is the location of pubic symphysis. This foramens which you see over here is a part of the hip bone, and this is obturator foramen. Then coming to the femur, this is the head of the femur. This is the head of the femur. Then at this location, this is the greater trochanter of the femur. And if any small prominence is present over here, so that will be the lesser trochanter. That will be the lesser trochanter of the femur. So when we see the femur over here, let us see femur separately. So this is the femur bone, and towards the upper end of the femur bone, you can see the big prominence which is present over here. This is a greater trochanter, and a small prominence which is seen on the medial side, that is lesser trochanter. Both the landmarks are very, very important for the femur. Okay, now coming to this image, yes, this is again very, very important image. This is the image for the bones of the foot. First of all, let us see this image, which is the superior view. In the superior view, this bone is talus, this one is calcaneum. In front of talus, the boat-shaped bone which is present over here is navicular, which is a very commonly asked bone. So this bone which is present over here, this is the navicular. This bone, a cube-like bone, this bone is cuboid. In front of the navicular, you are having three bones over here which are cuneiforms. Which are the cuneiforms? Now, the navicular bone is the most important, and keep in mind that it is present towards the medial side. Okay, it is present towards the medial side. This is the medial and the lateral side. The navicular, first of all, it is present towards the medial side, and it is just present anterior to the talus. So in the superior view, you can very easily identify it. And if by chance, if you see the medial view, this is the medial view. In the medial view, this bone is talus, and any bone in front of the talus is navicular. Okay, this is the navicular. If we see lateral view, let us see the lateral view over here. This is the lateral view. In the lateral view, you can see this is the talus bone. In front of the talus, again, whatever bone you see is navicular. Calcaneum, in front of the calcaneum, whatever bone you see is the cuboid. So this is how you are going to identify the navicular as well as the cuboid in this image. And if this X-ray is given, this is the superior view over here. So you can very well see that this boat-shaped bone, which is present towards the medial side, this is the medial and the lateral side of the X-ray. So this boat-shaped bone which is present towards the medial side is navicular. Just anterior to it, you are having these three cuneiforms, and on the lateral aspect, this bone is the cuboid. This is on the lateral aspect. So when you see the superior view, the talus and calcaneum, they are overlapping. So on the posterior aspect of image, you cannot visualize talus and calcaneum properly. So when you see a boat-shaped bone or like a slightly curved bone, which is towards the medial side of the image, this confirms that this is the navicular bone, right? Okay, now coming to this image, this is showing the muscles of anterior compartment of leg. And in this, when you have to identify all these muscles, how will you identify? With the help of tendon, where it is going. Now, if we trace this green tendon, or let us first of all trace this tendon, this purple tendon, it is going till the great toe. So this is extensor hallucis longus, and if the tendon is going toward the other toes, so this will be extensor digitorum longus. Then if we trace this green colored muscle over here, the tendon is going till this point only. So it is ending in the middle of the foot, okay, in the middle of the foot. So this muscle is tibialis anterior. Okay, this muscle is the tibialis anterior muscle. In the next image, this is the image which is showing the arteries towards the foot side, and this is a lateral view, anterior side, and this is the posterior side. So we very well know that this artery is anterior, this artery is anterior tibial artery, and the artery which is on the posterior side, this is the posterior tibial artery, which is a very, very important artery. So this artery over here, this is the posterior tibial artery. Now, apart from this, we say the anterior tibial artery continues into this artery, which is dorsalis pedis artery, and posterior tibial artery continues as plantar artery over here. So this is the posterior tibial artery going towards the sole as plantar arteries, medial and the lateral plantar, and anterior tibial artery over here continues as dorsalis pedis artery, which is towards the dorsum of the foot. Very important over here, posterior tibial artery. Now coming to this blood supply of the stomach region or the branches of the celiac trunk, first of all, very important for you is the branches of celiac trunk, and in that too, the branch which is going towards the spleen. So you will observe this branch going towards the spleen. This will be, of course, splenic artery, because it is going towards the spleen. Then any branch which is going towards the lesser curvature of the stomach, this is the left gastric artery. Any branch which is going towards the liver, this is the common hepatic artery. So first of all, you should be able to identify these three main branches. Then we say that we have branches along the greater curvature of the stomach. These are the branches along the greater curvature of stomach, and these are gastroepiploic artery. On the left side, left gastroepiploic, on the right side, right gastroepiploic artery. So these are very important branches which are present at this level. Coming to the next section, this is the transverse section of abdomen. If you see, this is the anterior side and this is the posterior side. posterior side you can identify with the help of the vertebra. And when you see this section, you can very well see this bigger section over here, which is of liver. So we know that this is the right side and the other side is the left side. As you go from right to the left side, now you see also this section of stomach. And when you go towards extreme left side, you can see a small triangular section over here, which is of spleen. So these are the three organs which are present from right to the left side. And when you go more posteriorly, you can see the sections of the kidneys. This is the right kidney and this is the left kidney, the oval sections which you see over here on the either side of the vertebra. Now apart from this, we should know two more sections which are of the vessels. This is the vertebra. Just in front of the vertebra, whatever round section you see is the section of aorta, specifically descending aorta. And another venous section which you are seeing over here, this is the section of inferior vena cava. So two vessel structures which are seen in the section over here. Now coming to this image, this is the image of the ovary, and over here you should be able to identify the follicles. When you see the follicles, you are having the primordial and this primary follicle. In this, no cavity is there, okay, no antrum is there. So we say that they are pre-antral follicles. And in the primordial follicle, in the center you will see the oocyte, and on the outer side only one layer of cells is there. But when you compare it with the primary follicle, in the center oocyte, and there are multiple layer of cells which are surrounding it. So this is the primary follicle and this is the primordial follicle, pre-antral follicles. Then after that, the small cavity it develops, which is given the term as the antrum. And we say secondary follicle and the Graphene follicle, they are antral follicles. In the secondary follicle, you can see that small antrum is there. So we say when the antrum starts developing, it is secondary follicle. And when the antrum, it has increased in size, as well as the follicle also has increased in size. So this one is the mature Graphene follicle. Now coming to the next image over here, these are certain congenital deformities. As you can see over here, this one is anencephaly, which we know is due to the failure of closure of cranial neuropore, also known as anterior neuropore. And the spina bifida is due to the failure of closure of caudal neuropore, which is also known as posterior neuropore. Then coming to this deformity, very important, this is omphalocele, also known as exomphalos. What is the reason behind it? The reason is non-reduction of physiological hernia of midgut loop. Now over here, this is the image which is showing the development of the diaphragm, having different features. And in this, the most important structure to identify is the septum transversum and pleuroperitoneal membrane. When you see the image, the vertebra is present over here. So this is the posterior side and that one is the anterior side. Towards the anterior side, the complete area, pink area, is septum transversum. Towards the posterior side, this orange area over here and as well as this orange area over here, this is the pleuroperitoneal membrane. So these two structures are important to identify in this image in the development of diaphragm. Now as you see this image over here, this is the image of the cleft lip. And what is the reason behind it? Yes, we know very well. It is due to the non-fusion of medial nasal process and maxillary process. So now over here, thanks to all of you for watching this video, and I hope that this video is very helpful to you during this revision process. So bye to all of you and best wishes from my side.